Hello, everyone, and welcome back to episode 64 of Your Birth Bestie podcast. Today, we are diving into a topic that challenges a common hospital routine, which is giving birth without a single cervical check. We are going to talk about how you can assess labor progress in other ways, understand the true necessity of these cervical exams, and how to advocate for the least invasive birthing experience. This is something that I know you are going to encounter if you are a pregnant mom right now, but if you're also a birth worker listening to this as well, this is something that is important for you to understand and to feel comfortable advocating for, these alternatives to the usual routine ways of cervical checks in the hospital. So this episode is all about cervical exams and helping inform others about ways that we can assess labor progress without them, and maybe why we would want to think about doing it this way. Hey there, I'm Beth Connors, a midwife and mom of two, but also your birth bestie. In this podcast, we'll dive deep into everything you need to feel confident, prepared, and in control, from baby bump to delivery room, from practical tips to personal stories. We'll cover it all so you know exactly what to expect every step of the way. Let's get into it. So first, I wanted to dive right into the fact that cervical exams are so common in hospitals, and was actually one of the many things that when I started as a labor and delivery nurse, I, trained on the job in the medical system, and I remember questioning why we were doing them so often. I definitely had second thought it, but I also didn't know any better at the time that there were other ways, and that documenting a woman's dilation in centimeters of how open the cervix is, how effaced they are, or how thin the cervix is, and the station, which is how high or low the baby is in mom's pelvis, was really not all that helpful in predicting labor progress and when the baby is actually going to be born. It was a tangible, documented number to show progress over time, but clinically, it didn't really give good information to make those next step decisions. And I have learned a lot since those days as a labor and delivery nurse, so that is why I want to share this information with you. But in general, cervical exams or vaginal exams are a standard procedure in hospital births that entail a healthcare provider like a doctor or midwife or a labor and delivery nurse inserting two fingers into the vagina and up into the cervix to feel and measure with their fingers how dilated, effaced, what station baby is at, how soft or firm the cervix is, and then the position of the cervix, whether it's more in the front or back or in the middle. This is done to assess and to get an idea of how far along labor has progressed, and usually is done every 3-ish hours in the hospital when a woman is laboring. And you might be wondering why they would be doing this so often. And this is because they provide a really quick and easy way for healthcare providers to gather information that can then be documented. Hospitals are, of course, very data-driven places, and having measurable data like cervical dilation can be useful for documenting the progress of labor and even comparing it along what's called Friedman's curve, which is an outdated practice that puts expectations on labor progress in dilation over a certain period of time. Every labor progresses differently, though, and in my opinion, and within the midwifery model, is not something that, is valued, is that every mom is different, and that we shouldn't be going off of these really strict standards that moms should be delivered, in a certain amount of time, or after, a certain amount of time, augmentation or speeding up labor needs to be done. So this is outdated and something that me personally is something I wouldn't practice myself. Women are individuals, and in their own care, their labor should be treated as such and not rushed along compared to these standard guidelines. So overall, it's important to know that these exams are frequently done more for data collection and documentation purposes rather than out of medical necessity. And this isn't always the case, but just generally something I've noticed. It can absolutely be appropriate to assess the information if the plan of care may change, but just to check, or because a certain number of hours has gone by and we're looking for a reason to speed things along, definitely not something I personally would practice or really want to be in support of as a patient myself. Some people like to know this kind of information, but I want women to know that you have to agree to a cervical check. It is never required just because your provider wants this information. And I hope that makes sense and that you are not, feeling like you're being difficult for declining or for asking for more time in between checks, because it is perfectly reasonable and perfectly okay for you to labor at your own speed as long as everything else is going well and you are feeling well and you and your baby are doing well. So definitely an option that you are not forced to have cervical exams every few hours in labor. I also wanted to mention, which I kind of did before, but further talking about how cervical dilation is not a good predictor of labor progress. Many people think that if they know how dilated their cervix is, they will be able to predict when the baby will be born. And it would be lovely if we knew exactly when the baby would be born, but this of course isn't the case, and cervical dilation is just a small piece of this puzzle. A woman can be dilated to 3 or even more centimeters for weeks and weeks and weeks before actually going into active labor. Or on the other side, she can go from 1 centimeter to fully dilated in just a few hours. I am personally that one that this happened to with both of my pregnancies so far, and I will definitely report back with my birth story with my third baby when the time comes. But with both those pregnancies, I was 6 or 7 centimeters dilated both times with no signs of labor. If it wasn't for a cervical check at a routine prenatal appointment, I would have had no idea. But because I knew this information, my providers pushed for an induction, interventions, and augmentation of labor with breaking my bag of water and other things as well that I would not consent to this time around. I didn't need to know this information, and it really wasn't helpful. So basically, this means that cervical exams don't actually give us a reliable timeline for when the baby will arrive. They can be an okay guess, though, by providing a snapshot of that exact moment, but they don't predict the future, and also you don't know how long that exam has actually been accurate for. Were you dilated 2 hours ago? Was it 10 minutes only since you dilated? So we really have no idea, and it makes that prediction very difficult. And then because of this lack of, not being able to predict the progression of labor, cervical exams can actually, a lot of the time, cause unnecessary stress for the expecting mom. What can happen is that you are going through hours and hours of intense labor contractions, and then you get to the hospital to be checked for admission to a room, and then maybe your provider says, you're only 2 centimeters dilated, and moms hear this, and if labor has really been intense, they may think, how the heck are they going to do another 8 centimeters of dilation, knowing it probably will continue to get more intense. And it can be really disheartening and make you feel like you are, not making any progress, something's maybe wrong. Even if everything is moving along just as it should and everything is going perfectly fine, you don't know if those 2 centimeters would take 10 hours and then, 2 to 8 centimeters will be an hour. You have absolutely no idea, and it absolutely can get into your mind, and, you can have a negative experience and some anxiety or some fear about, the next steps of your labor. This focus on numbers and data can then distract from that natural flow of labor and really add anxiety to the process, which then, of course, doesn't help with all of the hormone release and the, labor progressing naturally. So it really is such a mind game that can affect physical performance and outlook of labor for moms. And that is something that really bothers me for moms. It's like we are sabotaging their experience by just being a little bit curious about dilation, even though, remember, that it is not even a predictive exam. So yes, while cervical exams are routine, it's a routine part of a hospital birth, their main purpose is often for data collection rather than medical necessity. Cervical exams don't reliably predict when your baby will be born and can sometimes cause more stress than reassurance. Understanding this can help you advocate for a birth experience that feels right to you, remembering there are other ways to assess labor progress that don't involve these routine cervical exams, which is coming up very soon here. So now that you know a little bit more about why cervical exams are done and how routine they are in the hospital setting, I wanted to also mention the risks associated with these exams. Informed decision-making comes down to knowing all of your options and then, of course, choosing the best one for you. So this conversation wouldn't be complete without it. Some people are totally fine with getting checked every few hours and taking some risks. Others would rather not and may have other risks as well from that choice. So basically, everything comes with some degree of risk, and that choice is individualized and comes down to your values and what you want for your own birth experience. The most common risk that comes with cervical exams is a potential for infection. Every time an exam is done, there is a possibility of introducing bacteria into the vagina and into the cervix, which can lead to infection and then complicate labor and delivery, even though it is a sterile procedure and your doctor will use a sterile glove and lubricant with each cervical check. Another significant risk is the accidental breaking of the bag of water before contractions are well established, and this is called premature rupture of membranes, or PROM. When the membranes rupture before labor starts, it can increase the risk of infection for both the mom and for the baby, and can lead to potential intervention such as induction or augmentation of labor, or even a C-section. And then beyond that physical risk, cervical exams can have a substantial emotional and physiological impact, a topic that I don't think is often considered enough at all. Many women find these exams to be uncomfortable or even painful, so the experience of having multiple exams over the course of labor can lead to feelings of discomfort, stress, and even a sense of violation if you're not really understanding why these are even being done to you. It is important to recognize that childbirth is an extremely personal and vulnerable time, and anything that adds to that emotional burden can negatively affect that birthing experience. The physiological impact of feeling exposed and the stress of anticipating that next exam can really overshadow the empowering aspects of childbirth, which is just really so unfortunate when they are being done so frequently without medical indication. As we also know, labor is a delicate process that relies heavily on the mom's ability to really relax and let her body do the work, and frequent cervical exams can disrupt that natural progression of labor, and it really breaks off that concentration and flow when an exam is performed, pulling mom out of her focus, and then can actually slow down labor progress. And then with that slowed progress, of course, there's always that increased possibility of then leading to the cascade of interventions, as healthcare providers may feel the need to then, more manage labor that appears to be stalling, when in reality, it just needs a little bit more time to progress naturally. Usually a woman's body will progress in spontaneous labor at a rate that is perfect for their, baby and for themselves. And it is a lot of times, we're not giving moms enough time and baby enough time and patience to really find out how long that will take before interventions are recommended, because they are just recommended so soon in labor. I definitely see this way more often than not in the hospital setting, and it also happened to me personally too. The normalization of this scenario and this medical intervention based on the timeline that comes with frequent cervical checks doesn't help either, but this is exactly why I want to spread this information about it to you too, and have you have more of an idea before you have your baby of what is actually necessary and what these cervical checks are actually doing. Which then leads me to the part that maybe you are most interested in learning about and why you're listening, is exploring how you can assess labor progress without relying on cervical exams. And there are several effective ways to understand how labor is progressing, from observing contractions to recognizing behavioral and physical signs, and also monitoring the baby. So let's start by looking at the role of contractions in assessing labor progress. One of the most reliable indicators of labor progress is that pattern of contractions. As labor progresses, contractions typically become more frequent, they become longer in duration, and they definitely become more intense. Early labor contractions may be spaced far apart, like 8 or 10 minutes apart, lasting around 30 to 45 seconds, and they are pretty mild usually, they're not very strong. As labor moves more into that active phase, contractions usually come about every 3 to 5 minutes, lasting about 60 seconds, and then they're progressively getting more intense. Transition, which is that final phase before pushing, is marked by contractions coming even closer together, about every 2 to 3 minutes, lasting 60 to 90 seconds, so a little bit longer, and they are very, very intense. By paying attention to these patterns, this is just one example of how you can gauge how far labor has progressed without needing a single cervical exam. Another important part to consider is how mom is acting and how she sounds. This one became pretty obvious the more births that I attended. You don't need much more information when you hear those deep primal noises from a mom that the baby is probably pretty close to being born. The sound of mom pushing to and bearing down is usually very obvious as well. So generally, as labor progresses, a woman's behavior and vocalizations often change. In early labor, she might be able to talk through contractions and move around easily. And then as labor intensifies, she may become more focused and quiet during those contractions, really concentrating on her breathing and coping techniques. And then the more obvious one is during active labor and transition. Those vocalizations might include moaning, groaning, and other sounds that reflect that intensity of those contractions. These changes can provide some really good, accurate insight about how far progressed in labor mom is. And of course, there are some exceptions to that rule, but generally this is, a pretty obvious way to assess how far a mom is progressed in labor. There are also specific physical signs that can indicate labor progress. One sign is the purple line, which is a reddish purple line that can appear pretty much right above the butt crack as labor progresses, and the line extends upwards from the anus and is thought to correlate with cervical dilation. There may also be changes in the perineum, such as bulging or increased pressure that would indicate that the baby is moving down the birth canal. These physical signs can be observed without the need of these invasive exams. So those are a few ways to assess labor progress without a cervical exam, but I did also want to briefly mention reasons why you might actually agree to a cervical exam when there is good information that it is able to provide that can change the plan of care, no matter, if your situation is changed from being low risk to something else going on and you want to have this information. One reason would be if there is a concern about preterm labor. A cervical exam can help assess whether the cervix is dilating prematurely, which may require medical intervention to delay delivery and then improve outcomes for baby. Also, during pregnancy, if a medical reason comes up that induction is recommended, a cervical assessment helps determine the cervix's readiness for induction and is a part of the decision-making process about what is the best way to help your body safely get into labor, so something to be aware of as well. And then during labor, cervical exams might be needed to monitor the progression of labor more closely if there are complications, such as fetal distress, and it has to be assessed whether it is, safe to continue laboring for a bit longer and help the baby be born, or if birth is unlikely to happen quickly and other interventions might be needed to maximize the best outcome for baby. The other one that I can think of is if you are, managing labor contractions and things are getting more intense and you are agreeing and you are asking for the epidural. Sometimes moms will want a cervical exam before they get any type of pain medication. And there are certain times, like IV pain medication, where it is not safe to give super close to delivery. So there are times whether you request IV pain medication or the epidural that you might want a cervical check before moving forward with either of those. On the other side, there are medical scenarios where avoiding cervical exams during pregnancy and childbirth might be the best choice. For example, women with a history of premature rupture of membranes or those at risk for infection can benefit from minimizing the number of vaginal exams to reduce the risk of introducing bacteria. Also, some moms with a history of trauma or sexual abuse may find cervical exams particularly distressing, and their mental well-being could be better supported by opting for other monitoring methods. And in these situations, like we've already talked about, in low-risk pregnancies where labor is progressing normally, healthcare providers may rely on other ways to assess this labor progression, such as, the frequency and intensity of contractions, how mom is acting, and then those physical signs to monitor the progress without routine cervical checks. By avoiding unnecessary interventions, the birth experience can be made more comfortable and respectful of mom's preferences and needs, regardless of their situation. And then the last thing I wanted to talk about was the impact of hands-on interventions like cervical exams on the entire birthing experience. I am passionate about physiologic birth and encouraging and supporting labor to progress naturally, and I want to further explain how less intervention can empower mom in her experience. And what I mean by a hands-off approach to labor, I'm talking about minimizing unnecessary medical interventions and allowing the natural process of birth to unfold all by itself. This can include avoiding routine cervical exams, frequent monitoring, and then other invasive procedures. Empowering mom is such an important part of the birthing process because when interventions are minimized, mom can focus on what her body is telling her and her instincts to guide her throughout labor. This empowerment comes from trusting her own body and the natural process of birth and doing things instinctively like moving freely and choosing positions that feel comfortable and using coping mechanisms that feel most relieving. This active participation can significantly make her birth experience more positive and individualized, really giving her a sense of control over absolutely everything. So now that you know it is possible to labor without a single cervical exam, it's important to talk about how to advocate for this if this is something that you are wanting. Informed consent is something I talk about a lot, and it is a fundamental right in healthcare, especially important during labor and birth. This means that you have the right to be fully informed about any procedure or intervention, including its benefits, the risks, the alternatives, before giving your okay to move forward. Understanding your rights and the reasoning behind different interventions allows you to make empowered decisions about your care, so definitely don't hesitate to ask questions and request more information if something isn't clear to you. It is your body and it is your birth experience, so remembering this first and foremost is, in my opinion, the most important thing. Also, communicating your preferences to the healthcare team is another part of advocating for yourself that, for me, is what I see families struggle with the most. Most people don't like confrontation or feel like them declining something or asking for more time makes them a quote-unquote difficult patient, or the healthcare staff will be upset that they have different views on, or opposing what's recommended by the healthcare staff. But it is okay. It is your birth story, not theirs. And the best way to do this, I think, is by creating a list of birth preferences and sharing it with your healthcare team, even before labor begins, and review it with them to ensure that they understand and respect your wishes. During labor, then you can continue to communicate openly and confidently about your preferences. And this is a really helpful role as a doula as well, if that is something that you're interested in, because a doula in particular is trained to support you throughout your labor and can act as an advocate for you, helping you navigate any of those challenges that might come up and ensure that you feel confident and empowered and respected throughout the entire process. And you can really have the experience that you've always wanted. Thank you so much for tuning in to Your Birth Bestie podcast today. I'd love to wrap this up by reminding you that your birthing experience is yours to shape. Knowing your options and understanding that cervical exams aren't the only way to assess labor can empower you to make the best decisions for your body and for your baby and have the experience that you are most comfortable with. I don't want any mom to feel pressured into anything at all, especially an uncomfortable, possibly, unnecessary exam in an intimate area. Keeping pregnant moms and families comfortable, confident, and feeling safe and respected should really be the priority, and limiting or completely eliminating cervical exams when unnecessary is a really good example of this. Thank you again for listening, and I will be back here next week with another episode. Bye, everyone.